Not even call it basic.
By Nigeria, like if you go to the hospital and they test you now they most likely test you for malaria.
Right?
I don't know why that is like that.
It's not basic. As basic as it sounds.
I agree.
It's not what you think. All right, Lagos. The program is Health Insurance Today on radio, here on Lagos Traffic Radio 96.1 FM. I'm still looking forward to your call. You can put a call through or send a text to us. Let's hear from you what your concerns are with health insurance. I mean, here is a testifier in the studio, and he's just going to tell you how it feels to be an enrollee. He's been benefiting from HMO, and he can share with you his experience. If you have any concern, we can also help you out, in advising you on how best to handle some of these situations. All right, then, beyond the money, how did you feel like knowing you had coverage during health crisis? Would you say health insurance gave you peace of mind?
Yeah, of course. Total peace of mind. Like, just like now, if my wife is complaining about her back, I'm not going to be bothered about anything. I'm just going to be like, go to the hospital, please. Because at the same time, I'm like, nobody's paying for anything. It's already taken care of. Please go to the hospital, go and do a proper checkup. Don't just assume that, your back is spinning you because of the way you slept or something. Just go to the hospital and let them tell you that this is what is wrong with you. There's nobody that is, we're not going to pay for anything. So it gives total rest of mind for myself, for my wife. Like, it cannot be exaggerated. Let me put it like that.
There are two sides to a coin, right? For everything that is rosy, there must be the challenging part of it. Tell me some of the challenges, or at least something you have faced using health insurance that is quite challenging for you, but it's something that you can overlook, but it's a challenge. It might be a big deal for someone else.
Okay, so to not disregard the fact that yes, there are challenges to some things, because if I was going to say there's no challenges to using it, but the challenges most likely would be for individuals that are not tied to an organization, is paying the cost of it for a year, is getting the actual money to start it up. Because some people might feel like they might look at the opportunity cost and be like, maybe I'd rather spend the money on this than spend money on that. But you can agree with me that one of the most important thing, not one of the most important thing, if not the most important thing as a human being, is your life, your health. So there's really no challenges for me. Let me be down to earth. If you don't want to experience challenges, do your research before you register on any healthcare provider. You need to do your research. You need to ask people that have used a particular healthcare services, because at the end of the day, there are mediocres out there. We have to put it there. There are mediocres out there, so you don't want to subscribe to an healthcare provider that when you get to the hospital, the hospital will tell you that, your name is not on the list, you have to wait for, or you call your HMO provider, they will not answer you. You might be there for the next 1 hour, and then they will not, nobody will attend to you, and it might be a case of emergency, which can be beyond more than what it looks like. But just do your research. These are the challenges, so that you don't sign up to the wrong healthcare provider.
All right, tell me why you think every Nigerian, especially those with families, should consider health insurance.
It cannot be overemphasized. Let me put it like that. Your health, your life is the most important thing with you. And then, that's the first thing. When you understand that your life is very important, your health is very important, how you live is very important, that's the first thing that you need to establish. So once you've established that, you know that, okay, because of that, how do we take care of that aspect? How do I take care of my life? How do I take care of my health? Then there's insurance to cover that. There's insurance that no matter what your financial situation at any point in time is, once you've paid for it for a year or for a particular period, it will be covered. So if you have a family now, your child is sick, and you don't have to be bothered that how much do I have to take the child to the hospital to do the proper care. You just have to take them there.
At least for a start.
Yes, and then, we need to stop self-medication. That's the truth. And if you have a a healthcare provider, it will help you. It will save you from doing any form of self-medication. Like when I was the HR of an organization, and an employee will call me that they're not feeling fine, they won't take a day off. I'm like, okay, no problem, but please make sure you go to the hospital, because we don't want you assuming that, oh, I'm just going to take Panadol and I'll be all right. Like, no, please go to the hospital and then
just medication.
Yes.
Just a pill.
Yes, do a proper health. It's not even about the healthcare providers. I'm not here because of the healthcare provider. I'm here as a human being. Like, it's important for you to take care of yourself. So it can never be overemphasized.
All right, then, as we wrap it up on the some people believe health insurance in Nigeria does not work. Based on your experience, what do you have to say to this?
Like, I understand that. So let me go back to when I said I was working with an organization. We had staffs that they'll tell me that they're not using the HMO, that they don't believe in it, and I'll be wondering, like, we're using the same HMO. The HMO that you're using is the same HMO I'm using. Like, what do you mean it does not work? They just don't want to believe that a system where they will go to the hospital and they're not paying for it does not work. It feels like it's not real. I can understand, but at the same time, that's a lie. That's a total lie. Trust me when I say it is. In fact, for people that want to get a job, when you want to get a job, don't agree to work with an organization if they're not going to provide you with health insurance. Health insurance. Don't agree to it. It's part of your salary. It's mandatory. Just like when they deduct tax from your salary, it's part of it. So it shouldn't even be something you should compromise about. It's that important. It works very well. I've been using it since 2010. This is 2025. That's 15 years. And trust me, like, when I want to work with anybody, I would tell them, like, oh, okay, what about HMO? What about HMO? It's so important to me that
All right, then, as we take this home now, what advice would you give to someone listening now who is not sure, or or maybe even afraid to sign up for health insurance?
So, like I said already, your life is important. So go on Google, search for the top 10 best health insurance company in Nigeria. Look at their plans and look at the one you can afford, and then call somebody there and register. Just go and register. And I know you might feel like, oh, I might not use it for 3 months, I might not use it for 4 months and all of that. I know how that feels like. Oh, going 4 months and not using it, feels like it's a waste of money. It's not a waste of money. Go and pay for it, and go for checkup every month on your body. If you feel like you're not sick, just be going for checkup to make sure that everything is all right.
As a spinster or a bachelor, you think you're not using your HMO, it's not useful to you, at least go for checkup. I mean, we'll probably need to discuss the essence of checkups for a lot of people, because as Nigerians, we like to work, we like to run around, hustle without even paying attention to what's going on inside of our body. All right, I must say a very big thank you to you, Adeolu Adewunmi, Director, Organizational Development at AT Limited, Lagos, for sharing your personal experience about health insurance with us today. Also, let me say maximum thanks to everyone who tuned in to listen to Health Insurance Today on radio. Brought to you courtesy Sister Communications Limited. We hope you found our discussion informative and helpful. Do you know that you can access comprehensive health care cover when you subscribe to health insurance plan today? If you would like to know how to subscribe to health insurance plans for you, your family or organization, or you just want to know more about the topic of today, please call or send a message to 0901 538 8634. You can also email info@healthinsurancetoday.ng. Don't forget to tune in next week, Friday, same time, for information and insight on health insurance. Until then, stay healthy and stay informed. I am Taiwo Barua, signing out, but still very much within.